Dr. Srikanth. Srikanth, are you there? Please, you can switch on your camera.
I'm here, sir.
Yeah.
Can you hear me? Am I
Yeah.
clear? Okay.
So Srikanth is a very active member of our Diamond membership, and he is a renowned orthosurgeon, and he has a lot of interest in the AI and robotics also. So he'll be taking on this lecture today, and all over to Srikanth now. Yes, Srikanth, you can continue.
Thank you, sir. Thank you so much for your kind introduction. So I hope I've shared my slide. I hope is that visible, my slide?
No, you share it again.
Share it again. Okay, sure. Can you see my slides sir, now?
Yeah. You make it full screen.
Let me know when it's visible and stuff.
It's visible, but you can make it full screen.
Full screen, okay, sure. Is it full screen now?
No. Yes. Now
Yes.
it is.
Okay, brilliant. Okay.
Yeah.
So thank you so much for this opportunity. I welcome all of you to this first Cliniverse, I'm told by Dr. Pranav, and Health Talk, where we are in 2026. I think all of us here are doctors, and all of us here are Diamond members, so quite senior. And I think it'll be the most doctor-centric talk you'll probably ever hear in your life. You know that I can assure you. So I hope you will enjoy this journey. And
There are members from all the I mean, all the levels, silver, gold, and diamond, all are there.
Okay, fantastic. So that is better. So I think you will just learn. I think Dr. Pranor Academy is a journey. You start from the silver and move on up to diamond, and then you XLE and others. And I'm an XLE member, and you can see a journey how it has benefited me, and you can follow some of the good things that I'm doing and not follow the bad things that we're doing. So anyway, welcome to this first Cliniverse talk and Health Talk where we are in 2026. As I understand, it's a very diverse group, so I'll keep it very, very basic as far as orthopedics and arthritis is concerned. I'll not go, I don't know how many orthopedic surgeons are in the group, so I'll keep it very basic. And about myself, I'm Dr. Srikanth Ken, consultant knee and hip surgeon. These are my qualifications. Particularly proud to have worked in Wrightington Hospital, the birthplace of joint replacement surgery on earth. I'm a consultant in trauma and joint replacement surgery at St. Mary's, UK, and also proprietor MD of Sarthi Super Specialty Orthopedic Center here in Bangalore, in South Bangalore. I'm also attached to Apollo and GM Group of Hospitals as well. So this is the Cliniverse first edition. We're going to cover modern concepts in joint surgery in the era of AI, and also creating your legacy as a digital coach in 2026. So sir sent me the objectives of Cliniverse, and I think I was going through that in detail. And I think the whole idea is to create a collaboration among doctor-preneur community members like us, in particular Diamond members who have invested in this concept. So we can sort of, eventually sort of sell courses what we create in the DPA, starting first with the DPA community, and then to the wider, larger public, because we need to get confidence in ourselves how we are creating courses and selling it. We can do it ourselves, then we can do it to the outside people as well. As they say, charity always begins at home. And also the idea is to make our members thought leaders, not just doctors, surgeons, but thought leaders in medicine by sharing clinical insights, what Dr. Pranav mentioned, real world experience and practical knowledge. And you're going to see a lot of this today. With the patient first approach, very, very important. I think this is a key thing. Without patients, that's our bread and butter. And I think we should have a completely ethical mindset of practice. And the patient first approach is very important. Evidence-based approach is important. Again, which fits into the patient first approach, which shows integrity and collaborative, because we are not here to compete, we are here to collaborate. And that's the whole reason why Dr. Pranor Academy came. And leading to a growth mindset, not pulling each other down, but helping each other, not restricting each other down, curtailing our freedoms as students, but student first approach, not leader first kind of approach. There's a fundamental difference between teachers and coaches. We are all doctors, we are all great teachers, we do tremendous conferences nationally, internationally, locally, etc. So teaching, nobody needs to teach us as doctors. But there is a fundamental mind shift between a teacher and a coach. A teacher says, like, don't do, it's like, thou shall not, look at our own teachers. We'll ask permission, miss, can I do this? No, 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 you can't do that. So always teacher thinks from his point of view. But a real coach, that's a transformation, because he forgets himself. He only thinks about the students' problems, and he thinks about how to solve the students' problems in the shortest period of time. And that is a big mindset change. As a doctor, with so much of knowledge, like Dr. Pranav mentioned, it's very difficult for me myself to change my mindset. It is only in the last 1 year that I changed my mindset to that of a teacher, to that of a coach, where I think about my students, I think about what benefits them, and how I can solve their problems in the shortest period of time. Whether the student is a patient, or the student is a doctor, or other medical legal candidates, it really doesn't matter. The same approach we use. So how I've organized this talk, first I'm going to introduce about myself, because this is a question, who are you, gets asked to me repeatedly in India, but not in the West. In UK, once you are a consultant, you are equal, you're respected. In India, typically in a road, in my own, center's road, there's so many people practicing: quack, physio, LMP, RMP, Ayush, Krimsa, MBBS, MD, super specialist. All are called doctors, like physios. And the patient gets confused, and sometimes even the doctor gets confused. So India has a broken healthcare system, and it's one of the things which really made me come into Dr. Pinner Academy, because they were honest about it. And I'll show you evidence what exactly is happening. And I told you it's a doctor-centric talk, and you will, as a doctor, understand how to really manage the system, so that you're on top of it and you're not being subjected to what's happening right now in 2026. So I'm going to talk about latest in orthopedics treatment, and how technology like AI is helping fixing this broken healthcare system, how AI can fix it, how it is creating legacy as a digital coach, again using AI. So you want to see all the practical aspects of this way. So about myself, happy a day to all of you. I welcome all for today's. It's a very unique event, first of a Cliniverse event as well. Thank Dr. Pranav and the team, Dr. Pranav Academy, for arranging this. I train in UK in all aspects of orthopedics and trauma. Specialist, love and interest in computer-assisted robotic surgery, beyond robotics, which I'm promoting, hip knee, patient-specific implants, for which I read a General Medical Council with the recognized fellowship in Plymouth Teaching Hospitals. I have specialist love and interest in hip and knee, sports injury, and the redo surgery, which is called revision surgery, having done a 1-year fellowship in Avon Orthopedic Center, Bristol, which is one of the 5 centers of excellence in the UK. Also, I'm passionate about septic revision. This is infected revision, where we take infected knee or hip in the same sitting and put a new implant in the same sitting. Very difficult procedure, takes 4 to 6 hours to do. So we do offer quarterly referral service in India for these difficult patients, having done a fellowship in Endoclinic, Hamburg, Germany, which is the birthplace of this. I did a UG and PG from the prestigious Bangalore Medical College Research Center, BMCRI, as a National Merit Scholar throughout. I bring experience of more than 30,000 joint replacement surgeries over 20 years in the UK, and having worked in 4 out of 5 specialist orthopedic units called Centers of Excellence in the UK. So this is important, because these Centers of Excellence have kept the infection rate to, particularly in joint replacement surgery, to very, very less, 0.3%, compared to around 1 or 2% in the DGH in the UK. And we conduct a lot of state-of-the-art meeting. In the last Meet the Masters in December, we had top microbiologists in Karnataka who came and told us that India, particularly in the ICUs, is entering a post-antibiotic era, which means that, if somebody has a fracture, somebody has a stent, somebody has a diagnostic procedure, somebody has a hip replacement, knee replacement, their infection rate by 2030 will be 50%, 50. Where is 0.3%? Where is 50%? So as community, we have a great, role here to spread the message to the other doctors, so that we don't enter the post-antibiotic era, and we don't lose patients just by doing IV line insertion, or doing a cardiac angiogram, or putting a hip replacement, or fixing a fracture. That's a tragedy, really. I think we need to move our people away from this post-antibiotic era. So coming to, I'm also a director of Meet the Masters course. I mentioned about the last one. And you look at the trajectory, each year we bring this between October to December. Around 4 or 5 years ago, we talked about robotics when it was not even introduced in India. 5th meeting was on the augmented reality and mixed reality in orthopedics. 6th was on the artificial intelligence. 7th was on beyond robotics. 8th meeting happened in December 2026, and we talked about the knee and hip replacement for life. Once it is put at the age of 50, 60, it should last for life. And we passionately believe at SSOC that we can do that now in India. Although many people, still coming to that, but you will see why it is possible, in the further talks. We're using humanoid robotics to do that, and we keep pushing boundaries of understanding of orthopedics, not only in India, but throughout the world as well. Our objective is to provide affordable but very high quality knee hip replacement revision service in Bangalore, Karnataka, India. We do get patients from all over the country. And also, I'm a certified instructor for what we call as a synthetic intelligence. AI is dead, synthetic intelligence is the new thing. And here is my certification, which I recently got, where I was taught how to develop agentic AI agents and how to design, build, and deploy practical AI automation workflows using leading no-code platforms. I'm really proud of my teachers who have done that. Coming to my gratitude, to gratefulness, grateful to Dr. Pranav. I'm from a prestigious teaching institute, the Bangalore Medical College Research Center. It will be a blunder not to acknowledge our teachers and trainers. They say Guru Brahma, Guru Vishnu, Guru Deva, Maheshwara. So let's start with saying thank you to our teachers. Some of the big ones are, the person standing on my right-hand side, Professor Alistair Hart. He's called as a hospital hip detective by the BBC, very well-known orthopedic surgeon in the whole of Europe and US. And it was a pleasure meeting him. And he was also there in our Meet the Masters course, and he talked about the future of orthopedic surgery, particularly 3D printing. So here is my picture where I visited them in London, and on my left-hand side is Professor John Skinner, who is the president of immediate past president of the British Orthopedic Association, two biggest names in the world of orthopedics. I'm grateful because they still guide me, and we are still in touch, and we talk almost on a day-to-day basis, really. So experience relevant to this arthritis, I train in UK, all aspects of orthopedic trauma, special love and interest for computer-assisted robotic knee hip surgery, patient-specific implants. This is the General Medical Council of the UK, recognized fellowship at remote teaching hospitals way back in 2011, that is 15 years ago. This is presentation of fellowship by Dr. Jonathan Keenan, the director of orthoplasty at remote teaching hospitals, and still he's the director of orthoplasty there. In recognition of excellence in knee replacement surgery, I was nicknamed Sri the Knee. A revision knee implant in the left-hand side, a cricket bat, Plymouth Harbor, and a Sachin Tendulkar's body on my head, done by my boss's daughter. So what a creativity. My second fellowship was a revision fellowship by Navan Orthopedic Centre, Bristol, one of the 5 centers of excellence with Edward Smith. He's a former UK head of the European Hip Society and director of Bristol Orthoplasty course, and also worked with Anthony Ward, who is the director of pelvic acetabular surgery in the southwest of UK. This is Everett and me doing the first minimally invasive spare approach in All India Institute of Medical Science in India and Delhi on the left-hand side. And this is inaugural Meet the Masters course on the right-hand side, where I'm surrounded by my Professor Jay Krishna Reddy of BMC, who actually inspired me to become an orthopedic surgeon during my MBBS days. So it was just fascinating how all these things are coming together. My third fellowship at Germany, Endoclinic, Hamburg, with Prof. Garka. He doesn't need any introduction in the world of orthopedics. He with Dr. Javed Parvezi are two biggest names as far as infected division is concerned, where they take the implant out and put the new implant in the same sitting. Not many people in India do it even now, but not many people in the West were doing it when I trained with him. But now there are a lot of centers of excellence who are doing that in UK and Europe, really. Also worked with immediate past president of the British Knee Society, Richard Parkinson, my knee mentor. He was the president of British Knee Society 2014 to 16, voted the top 10 best knee replacement surgeons and teachers in the UK. I started doing revision knee surgery way back in 2001 when, almost the big names in India were doing trauma, really. So my experience with knees, it goes back several decades, really. Trained with Frederick Lord. He's a pioneer in anterior approach to hip. He's at Paris Laws, where he's teaching us how to do a approach from the front of the hip, and he's a very classic surgeon. He just does a hip replacement in 20-25 minutes, no assistant, just a scrub nurse and anesthetist. That's it. Trained extensively with revision surgeons. Prof. Wayne Poprowski doesn't need any introduction. Met him in Nottingham, UK, and he's basically all the acetabular fractures are classified, defects are classified on Poprowski. And Dr. Lawrence Zahara and Jeremy Latham are big revision surgeons in the UK. And my mentor's close friend is with Lawrence, and this is Jeremy. This is a dream come true. Professor Manoj Ramachandran is a professor of pediatric orthopedics at London. And he has written a book called Basic Sciences in Orthopedics. And it's an unbelievable book. And he's also AI guru. So I'm collaborating with him and working with Professor Manoj Ramachandran. And you can't pass a FRCS or exam in any developed country without reading basic sciences. So it was a dream manifestation for me to meet him. And I'm collaborating with AI because he, being a doctor, employs 500 surgeons, 500 engineers in US in his AI company. Can you believe it? That is real entrepreneurship. This is listen to some of my seniors. This is Dr. John Ebenezer, rare BC awardee and the president of Geriatric Orthopedic Society of India, and he's also vice president of IOA. And also my registrar, James Burstock, who runs the Bristol Orthoplasty course. And along with IMA, I do bring this course to the whole of India and Southeast Asia, being a regional coordinator. So let's see if this video plays for a short while.
It is a very exciting day for me today because this is a great academic collaboration with our own Srikanth. I have seen him grow right in front of my eyes. From Bangalore Medical College when he was doing his undergraduate course, so when I was there in that college. From then on to now, he has grown tremendously. And the quality of his academic meetings is amazing. A single man doing such outstanding work. So it is a privilege for us to be associated with him, JOSI, as a JOSI organization. He's our core member of Geriatric Orthopedic Society of India. We felt that if he associates with his organization, then he can make a wider impact and reach greater audience. So now that we have got the accreditation also coming from Karnataka Medical Council, so this will add. It's a win-win situation for him and for us too. So I should thank Amarnath for all the labor he puts into getting this medical council registration, which is not that easy in Karnataka. It is a very difficult job. He does it. He's an efficient man, and he organizes things very well. He takes the load off my head so much that I can breathe and can relax. And because of him, we are able to do a lot of programs like this. So all the best, Srikanth. You have lined up a very good program. Robotic surgeries and ligament, what to say, your robotic knee technique and some creative corners. So many things running in your brain. I'm wondering how it works. You come out with such innovative things, and you come out and make it very interesting. So I learn from you. You say you are my teacher, and you are my teacher too. I learned a lot of things from you.
Thank you.
Good luck to you, and I'm sure that this will benefit all the young and senior orthopedic surgeons and the postgraduate students too. Good luck to you, and hope we'll have many more collaborations like this. And we are with you always in your academic, what is the spread of this knowledge, which is a great service to mankind. Thank you so much. Thanks for the nice words you spoke about me, and
So this is James. James and we bring BHSC to whole of India. We trained more than 10,000 orthopedic surgeons in the last few years now in India. Great philanthropy, bringing best professors to teach from Kashmir to Kanyakumari, Malda to Mumbai.
Good morning. Good morning. It's my distinct pleasure to welcome you all to this year's Bristol HIP meeting. I think we've got some treats in store for you this year. We've gathered together some of the best speakers from around the world to give that, I hope, perfect mix of informative, interesting and entertaining talks. Now, we are also joined online by over 1,000 doctors in India, and I'd like to thank my friend Sri for setting that up, and also thank the Indian Medical Association, along with Doctor Technology, the media company, for making it all happen. Some house.
Yeah, this is another proud moment recently. This was our 50th Golden Jubilee Karnataka Orthopedic Association conference in my birthplace, Bijapur. I've been visiting Bijapur after 50 long years. After birth, my destiny took me to Europe, all over the world, but not to my birthplace. Very proud to talk about very complex knee reconstruction to all the orthopedic surgeons of Karnataka and India, and also chair multiple sessions there. And very proud to felicitate our teachers, the professors there from Miraj, Professor Kulkarni, a senior most orthopedic surgeon. And it was an absolute dream come true where on the day of my mom's birth, I could be in the same hospital labor ward where I was given birth to. So it all it was not my plan, it was a divine plan, how it happened. So, serendipity, as they say. So coming to Prof. Chikmaga, he doesn't need any introduction in Karnataka. He's a Rajyotsava awardee, and he's the first rheumatologist, I think, for India who did a fellowship with the American board. and very interesting insights what he says about rheumatology, arthritis, and things like that. So let's quickly hear from him.
Just last November, just this November, I completed my 8 years, 80. I do not have any problem. I think even now I am seeing my son's two doctors are there. They are not allowing me to do any patients since Corona incidents. I did not see the patients in Corona for 1 year, but I am seeing again patients. You should do the duty what God has assigned to you every day. Then only you live long. This is my experience. And I think Bangaloreans are very lucky to have a great orthopedic surgeon in Bangalore. Bangaloreans are really yes. In 1970, I joined MD in Bangalore Medical College. That is 50 years ago. I took the dissertation thesis for rheumatoid arthritis. And there is a saying in the literature that even the first human being on earth created by God has suffered from arthritis. This is a saying of our rheumatology books. The first human being created by God has suffered from arthritis. That is the significance of arthritis. And regarding to praise Dr. Srikanth, I have to praise you. It is my love and affection. You have just gone through his literature. That he is an excellent orthopedic surgeon. I feel very proud that you are my student and you are an innovative orthopedic surgeon. Innovative. Anybody in any field in science or any other field, he should put up his own efforts and he becomes a genius. When he becomes a genius, our work, genius means 99% perspiration, 1% inspiration. There is a saying. You must have inspiration that you should do this thing. And 99% perspiration, you should work hard. You should sweat. Then only you become a genius. So, to become a genius in any field, you should work hard. So, everybody, especially in the surgical field, they go on working. The skill, the surgeon develops, individually develops his own skill. You know, in cardiac surgery, many have invented so many methods. It is his own skill. He who works out and develops his own skill, he becomes.
So amazing insight. We are talking about arthritis, and Prof gave a wisdom that the first human being created on Earth suffered from arthritis. So it's unbelievable kind of wisdom, really, which only comes with experience. So what we are doing now is, we started what is called as a Nalanda orthopedic intelligence, and we started both for patients. That is, we launched it on 7th of March this month, and today is probably the launch for the doctors. And I'll take you through what it is. I told you this is a very doctor-centric presentation, and you'll see how where we are leading up to. So what is this Nalanda intelligence? And why? Digital coaching is a $26 billion US dollar industry on Earth now. And I think 50% of this money is that turnover is happening in the US, not in the rest of the world, really. If you go back to its origins, it started way back in 1870s in the US with people like Andrew Carnegie and Earl Nightingale. And they are the people who sort of created the greatest wealth creators on Earth, particularly in the US and the world, really. And they shaped the industrial revolution and everything. But if you really honestly look back, even in India, we started this kind of a revolution, way back in Nalanda University in present Bihar, thousands of years ago. Really. Nalanda was a civilization of seekers. Students came from all over the world at that time for wisdom, not for degrees as they do now in modern day, both in India and elsewhere. But they came to Nalanda to seek wisdom. Really. So why Nalanda? So I have, as many of you have seen, dual practice. I practice both in UK and India now. And the two practices for me are really poles apart. Sometimes it shocks me. And in India, what I find is commercialization of the healthcare. Recently there was an article where a person scored 4 out of 800 marks, and he got a MS orthopedic seat in a government medical college in Rohtak. And I was completely, my jaw dropped really. And, how can such people, we talked about ethics and how to look after patient-centered care. If I get 4 marks out of 800, how can I really look after my patient? It's a big question, really, which all of us have to answer. And again, we know the commercialization, 1 crore for MBBS, 5 crore for MD, MS seats in India, and the pressure to recover this investment is constant, what is called ROI. And no one wants sort of knowledge here in India, forget wisdom. They want a degree so that they can tell the regulators, judiciary, hey, I got a license to practice. And this is what is happening. So when the system is like that, the effect of that system is that, then the system, such a system then wants to exploit these doctors. And what is happening, even if you look at the corporate sector, there is no real salary. Only there is a minimum guarantee of fee for service contracts. If you don't meet your targets, then, it's not reached, then they bring another surgeon or doctor to compete with you. So both are forced into an unethical target trap. And this becomes, the doctor becomes a sales agent, this becomes a marketing agent, and a surgeon, taking all the risk, both clinical and legal. But if you look at what he gets at the end, he's only getting 8% of the MRP that gets billed to the hospital. While the sales head, the head of billing, the insurance head, CFO, CEO, we all walk happily to the bank from your hard work, from your legal risk, from your cutthroat competition, from our insecurity. This is what is happening. So this is, look at this paper clip, which says the NEET PG exam, single digit scores, get MD Gynec and MD Medicine. I think they scored less than 50 out of 800. The MS Orthopedics in Rota, Government Medical College is a shocker, 4 out of 800 to get an MS seat. So absolute shocker. So let us see, what really happens, because of that, how the system can really create issues, due to that. I'm going to compare, like myself to my engineering friend, or you can compare yourself to your engineering friend. We are doctors, we worked very hard, we got top marks, and that's why we become doctors. Those who couldn't succeed, they got lesser marks, they took engineering, they took MBA, other streams, when we did our MBBS. So let's look at our own classmate who's doing engineering, and our MBA, they scored less than us, and they got a job at the age of 21. And they often bought a flat at the age of 27. So let us look at our journey. We did MBBS, NEET, we had to wait 15 long years. We are made to wait to earn. We were made to wait to earn. And we did MBBS at around, say, 23. We earned around 20 to 30,000 rupees per month, while our colleagues who have done MBA or, my classmates engineering were earning close to 2 lakhs a month. Again, we did NEET, and, there's a 7% chance to get a government PG seat doing NEET. And at the age of 28 years, we became a consultant. We started earning 1 to 1.5 lakh salary per month, while these MBAs were earning, close to that anyway from age 21, 22. And an MBA earns around 25 lakhs per year. And by around the age of 30, he has got around 80 lakhs in his savings. And that money is compounding. Okay, by the time MBA hits his financial goal, he'll be the age of 33. And probably he has bought a second house, a second flat. Look at us, we reach our goals by age of 44. That is 11 years later. That means our prime time is wasted. As India needs us to work cheap during our prime time, to staff government hospitals, to fill rural posts, to run corporate floors with cheap labor. And that's how, we're being used here. So we are paying EMI of 1.37 lakhs per month with a salary of around 1.5 lakhs at the age of 28, while our engineering classmate has got a flat. The guy who was a failure when we got MBBS seat or equivalent seat is sitting pretty with his second home and saving in his bank by the age of 33. So we are basically taken for a ride in the name of service without our consent. Consent is everything in medicine, but nobody took our consent to do this to us. Even our understanding, many of us don't even understand that we have been taken for a ride in India. So why this is happening? Hospitals today are investor-backed businesses. Return of investment is very, very important. They drive the business. EBITDA, which all of you know, are highly focused on that. Patients don't understand, the treatment needs, alternatives, and the cost. There's a lot of doctor fragmentation. Doctors are individual players competing with each other, not organized, while hospitals are organized systems. So fragmented doctors lose to structured institutions. If we are not united as a structured institution, then other people will take us for a ride because we are individual players. So what is the problem in 2026? Doctor has to generate patients. That means he's a marketing guy. He has to convert patients. That means he's a sales guy. He has to deliver care. That is, do clinical work, to medical or surgical treatment. Then he has to retain patients that follow. Earlier, doctor was a decision maker. Now he's a revenue generator in the system. The hospital brand is always more important in 2026 than the doctor brand. So that there is a reduced dependency on star doctors, which reduces the doctor bargaining power in the healthcare really in 2026. The MBAs in the hospitals, they control the pricing, the targets, packages, and incentives, what the doctor should get. So the doctors carry the medical legal risk, the patient anger and violence, which all of you are very familiar with in India, but never control decisions, which actually lead to the above: medical legal risk, patient anger and violence, and doctors. Look at that. It's like a monkey, somebody, eats the, curd and then puts it on the monkey's mouth and monkey gets beaten. They're making us like that. So responsibility is no longer authority in India as far as doctors are concerned. Target culture. We talked about ethical, where Dr. Pranav Sharma talked target culture. Ethical erosion in healthcare in India is happening because of this target culture. There is a monthly targets for doctors, quarterly targets, procedure conversion pressures, internal competition among doctors, and that leads to over investigations, over treatment, burnout of doctors, and moral injury to the doctor's soul. And there is a salary paradox. Doctors don't have a stable, predictable salary structure in India. Income is always tied to procedure or patient volumes. You are paid like a business, but you are controlled like an employee. See how clever it is. Younger, cheaper doctors replace the seniors. This is not accidental. If you think, oh, this all happened, some God did it or karma did it. No, it's structural. It has been deliberately done for us. Why? Legal risk damage. Hospital earns, doctor signs, once you join a hospital, sir, sign here, sign your life away, as they say, and doctor gets sued. See how classic this is. So in Nalanda Intelligence, what we are launching for doctors, we want you to get out of this trap. This is the whole idea behind this talk and what the journey we are taking. We are using AI. So what are the solutions? So let me give the 6 top, tips how to get out of this trap really. Okay. One is, and this talk is all about that, and it intermingles these aspects. One is build independent patient funnel. So how can you build an independent patient funnel? By digital coaching, by what we are doing as Diamond and other, Dr. Pranav members. Build your own YouTube, your own WhatsApp, your own patient education network on TagMango or Xly. You control the patient flow. Hospital becomes optional, not your masters, but you become their masters. Second tip is become a decision authority, not an operator. Don't say I do surgeries. Move from I do surgeries to I guide decisions. Okay. Patient trust decision makers, then operators. Third, very, very important, collective doctor network, like Dr. Pranav Group. We got plenty of people joined online here. Many will watch later on. We need to form a collective network. Maybe 20 doctors alliance, there are more than 20 here, join together, form shared OPDs if you're from the same city. We have city chapters also for Dr. Pranav. Okay, shared legal defense, we have a very powerful medical legal group here now in Bangalore. I've studied with all the High Court and Supreme Court lawyers, very aggressive. If somebody touches the doctor, they'll beat them up. So aggressive. So be part of this group so that you are defended. It increases your negotiation power with any hospital. Then exit the target game. This target game, you will never win a game designed against you. This is designed against that Indian doctor. And, please get out of this. Okay. Work with smaller ethical hospitals. Maybe do 2-day corporate, 4-day independent practice models. Move from a volume-based to value-based practice. That is the way you can keep your soul also happy. Plus, very important, legal plus documentation mastery. Most ignored by doctors in India. It's a very, very big mistake if you are not medical legally, know the knowledge. We learn in our course documentation, defense, consent architecture, medical legal positioning, because knowledge is survival in 2026 when system shifts risk to doctors and profits to themselves. And multi-source income. We SSOC, we have 4 vehicles or verticals. One is a junior doctoral training with the best international faculty from abroad and called ELBS Orthoplasty Fellowship. Second is a patient training with Nalanda. I'll take you through how it is structured as a coach. And third is a medical legal training with a strong team of High Court and Supreme Court advocates who are very, very aggressive. And you need an aggressive legal team to protect your business. And fourth is miscellaneous. That is AI. We do develop app for different doctors, websites and things like that. And last but not the least, spirituality training also we do. So, feel free to join when the right time comes. The hard truth in 2026 is if a doctor has no independent patient flow, no medical legal knowledge, depends fully on the hospitals, then he's not a professional. He's a controlled economic unit. The system is not broken. It's working as it was designed to control us. Please understand. Will you continue playing in the system or will you redesign your position within it? That is the key question, really. So I mentioned the ELBS Orthoplasty Fellowship. The bottom left QR code is for that. And the first 3 ones who join, they get the free A, silver, course free, thanks to Dr. Pinna Academy. So how they're helping us in our digital coaching. And the right one you all know about, it's about the XLE QR code. Those who are not, I recommend you to take up XLE. It's a great system, really big. It helps you to launch the digital coaching. So why Nalanda coaching for patients, using AI? So this is something I launched in 7 March. So I'll just, as a digital coach, I'll quickly go through the template, what I follow for patients. I tell the patient India doesn't suffer from lack of surgeon. They suffer from lack of decision intelligence, And I take through a journey of my own patients, how I operated on them and what are the issues and the complexity of the patients. Whether one of the complex patients I treated, a very senior surgeon in Bangalore had failed 8 surgeries, and then I had to take it on and I had to do it. And there's a lot of political, almost it was like a Sherlock Holmes kind of movie really operating on her. So I tell the story to the patients, what exactly happened and how she got an outcome where she was bedridden for 3 years and she was able to walk, after 3 long years and 9 steps. And people say we operate for make money, but it's not for that, but it's for making people again walk and, mobility is life and giving life back. So, and then, I sort of take the patients through these different examples, ask them questions and reveal them the 3 secrets of how, they can avoid such complications really. And then, always, in the course when you're doing, DP Academy has taught us to give offers and, have a different offer. Like, I have used AI and I have created a complete arthritis module for all joint arthritis, taking right from basic anatomy, common myths in India, to non-surgical treatment, evidence-based, to surgical treatment, to robotics, beyond robotics, humanoid robotics, AI integration, everything I have put in the course. And of course, if they buy through the XLE, online, it's 20,708. And when I do special programs for patients like this, I give them a QR code, give them 10 minutes timer, and those who get onto it can buy it even now for this QR code for 10,000. So that way, the whole thing is structured. They get the evidence base. Because already I've taken through the ALBS Orthoplasty Fellowship for the junior doctors who want to learn about joint replacement surgery. And look at this. This is what we're very proud of. This we just created it last week, and you can just go through this.
Let me ask you something uncomfortable. If your knee pain becomes severe next year, will you know whether you truly need surgery or you are being influenced by fear? Most people don't, and that is dangerous. I am Dr. Srikanth KM, FFRCS Orthopedics, senior trained robotic surgeon from the UK, with nearly 3 decades in joint reconstruction experience in best centers in the world. I've seen 3 kinds of patients. 1, those who delay and suffer. 2, those who panic and rush into surgery. 3, those who understand their joint and decide wisely. Only the 3rd group brings long-term. Arthritis is not just wear and tear. It is cartilage biology, synovial inflammation, biomechanics, muscle imbalance, bone remodeling. If you don't understand the basics of a joint, you are negotiating blind. That's how people spend lakhs unnecessarily, do injections repeatedly without strategy, try random WhatsApp remedies, or fear robotics without understanding it. Ignorance is more expensive than surgery. Inside our silver level program, I personally take you through level 1, the anatomy of the knee and hip simplified, so you understand what exactly is damaged. Level 2, non-surgical pathways and common myths, muscle correction, alignment correction, load redistribution, evidence-based supplements, weight and metabolic control. Level 3, when surgery is necessary and when it is absolutely not. Then we go further. Everyone talks about robotics. Very few understand what robots actually do, where they help, where surgeon judgment matters more, what humanoid robotics and AI-guided surgery will change in next 10 years. The future of joint care is not robot versus human. It is intelligent integration, and those who understand this will never be misled. There are 2 types of patients, victims and informed decision makers. Silver members are not patients. They are educated partners in their own care. This level is not free because transformation requires commitment. Silver level investment, 9,999 rupees. That's less than 1 MRI in many cities, and it gives you lifelong clarity. Enrollment closes automatically when the without fails because I review content testing. If you value mobility, intelligence, long-term joint freedom, click the button below. Upgrade to silver. Don't wait for pain to force the decision. Decide before damage decides for you.
So when we launched the Nalanda for patients last week, I played this video and I asked, there are 100 patients in the room. I asked them, who is it? And 100% said it's me. But, it's not me. It is my avatar actually, which is talking. And what we're doing now, our avatar is ready. And all my clinical knowledge, in the last 2-3 decades, I'm in the process of feeding into my avatar so that, anybody can ask my avatar anytime, 365 days a year, 24/7, and avatar will be able to answer just as I answer from my experience. This is a welcome to the bold new world of generative AI, really. So how it's working. So I thank from this point. I'll quickly go to the knee and hip arthritis and basically touch basics of knee and hip arthritis and how AI is helping in this field. We know arthritis is a big problem in India. 20 million people suffer from them. 1 in 5. India is the largest knee pain sufferers in the world. COVID proved a big doctor shortage in India. And, there are a lot of things, arthritis, 1 in 5 Indians are affected, and 1 in 4 of them will need some kind of intervention, injection or joint replacement surgery in their lifetime, basically. And in joint replacement surgery, the basic thing is if I fail to prepare for surgery, I prepare to fail during surgery. It's a very, very important tenet, really. And when somebody comes with joint pain, we do ask common questions. Where is the pain situated? Was there a trauma involved? Did the symptoms come suddenly or over a period of time? Once these questions get answered, we begin to do investigations. Putting the symptoms and signs together often leads to a diagnosis. MRI latest investigation may not be the first way of investigation. X-rays often tell us more than sometimes PET scan tells us. The take-home message as far as arthritis is concerned, pain while walking down the steps is commonly due to a kneecap problem like chondromalacia. Morning pain with stiffness that resolves with activities typical of early arthritis. Sharp pain with clicking, locking of the knees, typically due to either a meniscal pathology or a kneecap problem or a loose body in the knee. A pop or swelling a knee giving way in a young person, a footballer or a cricket player is due to a cruciate ligament injury. And rheumatoid arthritis can also start as isolated arthritis in the knee. And these are the typical x-rays and investigations we do for arthritis. And how to treat it is, again, we go back to the basics, evidence-based, WHO, analgesic ladder, start with simple painkillers with paracetamol, work our way up the WHO ladder. You can Google and see what it is. We use walking aids, lifestyle changes. If all else fails, we do inject the knee. If there's isolated arthritis and infections ruled out. Variety of injections we use. Steroids stood the test of time for 100 years. We use the platelet-rich plasma. We launched a new concept called the joint widow or the SVF from Australia, which I do extensively, and it has really saved many patients from undergoing knee replacement surgery by avoiding knee replacement surgery. Actually, it's a cutting-edge regenerative medicine treatment we provide here at SSOC. Sometimes we use Synvisc and stem cells as well, very rarely, and this can be repeated a few times. The role of physio is very, very important, and also simple things like offloaded knee brace or insoles can also help along with weight loss. Kind of surgeries we do is knee pain is not equal to knee replacement surgery. We can do a number of other small procedures like a diagnostic arthroscopy where we put a camera inside knee and see what's happening. If there's a trouble with the meniscus, with the cartilage, we can trim it or repair it. If there's a problem with loss of cartilage, we can drill holes called microfracture where hyaline cartilage forms. If there's complete loss, then we can take cartilage from a normal non-weight bearing area, put it at cigarette pecks in that area called Wurtz grafting, or we can just take some samples from petri dish, hyaline cartilage, grow in a lab, and again put it back in artificial corticosteroid implantation or using a matrix. If the ligament is damaged like ACL, PCL, PLC, like our Rishabh, we can replace that damaged structures really. And indications for knee replacement in India, mainly arthritis 96%, osteo, inflammatory in 3%, post-traumatic in a small percentage. Females have slightly more preponderance than male. Types of knee replacement surgery, we don't need to do a full knee replacement all the time. Only one component is damaged. You can do a half knee replacement called medial lateral uni or patellofemoral replacement, which has become popular in India in the last 5-10 years. Total knee replacement, most of us know it's a big business in India. And what is new in that? The computer navigation is big. Robotics is big since COVID. 3D augmented surgery is becoming big. And all these things are technology leads to predictable accuracy, makes surgery safe and recordable. Data is the new gold, really. and it prepares better surgeons of tomorrow because it creates transparency in future learning and accountability, what is a part of the ethics really. And they all act like patient-specific implants because we now know in 2026, not all knees are same really. God has created each one of with a unique genetic print and unique knee anatomy. So knee replacement, what is it? It's the picture on the right side. It's a neuropathic space. It's a metal, doesn't have nerves, so the pain goes away. I mentioned about half knee, full knee, and other kinds of knee replacement. This is one of the first knees I did using navigation robotics in Plymouth way back. Some of the myths I found when I moved to India were that at that time I was using navigation by default, and I was told that eyeballing was better than using technology. But once the COVID came, robotics came, the same surgeons told me, Srikanth, robotics is better. And I told, sir, robotics is based on navigation. So how did your mind change, So I think life had come a full circle, really. So, and second aspect was one size fits all. Well, we know the truth is that every knee is unique, it's like our genes. And looking at an X-ray and doing a knee replacement in 2026 means giving a two-dimensional solution to what is a three-dimensional problem, really. And we can never plan surgery on the table. Table is a place to execute the plan, never to plan surgery. And other myths I found was that this is from the hospital management. Anybody can do knee replacement. It was like a EBITDA-driven concept, what I explained earlier. And my UK trainee used to say the same thing at registrar. It's so easy, but it's not. Knee replacement is not a simple surgery because of what father of knee replacement surgery, Dr. John Insall, said. He called it 50 years ago that knee replacement is a soft tissue surgery with some bony cuts. Most of the orthopedic surgeons didn't understand it for 50 years. Now with the advent of robotics, we are understanding. We're not even touching the soft tissue now. We're just using robot to just mill the bone. So now in 2026, after 50 years, we understand the great master, what he said, knee replacement is a soft tissue procedure with some bony cuts. So it's amazing. So knee has the number of ligaments. Each ligament has multiple roles. Many roles are not even understood now. And to do a knee replacement, you need this 3 cuts in the tibia femur and the patella. And knee has got the 6 degrees of freedom, what's mentioned. If you put permutation combination, even a senior guy like me can get a knee replacement in 215 ways. Forget about the fresh pass guy. So, real answer to the myth in India, anybody can do knee replacement. Clear no, if you have patient's interest and ethics in your heart. First principle of ethics is primum non nonsense. If in doubt, ask, no shame, do no harm. Proper training experience must do knee replacement. It's a complex three-dimensional hinge. It's not a simple hinge like a hip or other joints. So the modern concepts have come like a navigation, patient-specific implants, 3D, knee robotics, and beyond robotics to address these issues. This guy Usain Bolt, we know why he's the best in the world because you can measure what he has done, see the measurements. He's sitting by that measurements. Okay. The limitation of human eye, eyeballing can't differentiate less than 10 degrees of change in the angulation. More than 6 degrees change in angulation leads to failure of knee replacement. We all know that. We don't want a bad day at office to affect the outcome of patient surgery. We are human beings after all. We want to minimize surgeon error when so many factors are at play, some known and many unknown. 1 millimeter accuracy is humanly impossible to the human eye. And balance versus, the alignment is debated. I was in a meeting in Delhi with all the top guys in the world. We debated for one day about this. So these modern concepts have come, navigation, robotics, 3D augmented surgery. And, historically, a lot of things have changed. And, with 3D anatomy, we know that different axes of the knee are there. We have to put the implant parallel to the yellow axis, not parallel to the green axis, not to the yellow axis. Majority of surgeons are putting it parallel to the yellow axis. And that's why the patient-specific implants have come. I've been doing robotics for 4 years in Bangalore now, same principles, 1 millimeter accuracy, bone cuts taking 6 degrees of freedom into account, less soft tissue dissection, less pain. Almost I have stopped blood transfusion for all my robotic surgery patients now. They all go 1 day before compared to manual surgery. This is my first robotic I did here in Bangalore. And this patient had an early discharge, and you can see the bottom line there where the knee is balanced from 0 degrees to 130 degrees bending, and it's like 1 millimeter balance. And Dr. Kaper, the creator of robotics, will be very impressed with the flat line after the first implantation. It shows perfect soft tissue balance in the first CR robotics, in the whole range of movement. This is the first objective evidence that we can balance the soft tissue so well. This is a post-op X-ray of the same patient. This is her immediate recovery. She's able to not only raise the leg, operated leg, but also bend to 60-70 degrees. Not much in pain. My colleagues in Mumbai call it as a dancing knee replacement. Make the patient do garba. we do the same thing for patients
in
without
India.
making them dance in Bangalore. That's the only difference. So the future is here to stay, and we got all this 3D robotics and beyond robotics and humanoid robotics, the number of advantages. The whole bottom line is we are getting to the holy grail. This is a better function and a forgotten knee, which is the holy grail of knee replacement surgery. So what is happening now in 2026? I just came back from a meeting in Delhi with the top guys who are working with AI and robotics. What we now done is we have integrated AI into robotics. We've got a fully autonomous robot which we are creating. What we are doing is we are just like I created a twin of my avatar. The knee avatar can be created called digital twin of the knee, and we evaluate the soft tissue dynamics of the digital twin. Looking at the knee kinematics gives a perfect soft tissue, perfect results with inbuilt sensors in the knee. And post-operative, the patient is running too much. The sensor will tell me, oh, your patient is running too much. Ask him to slow down. So we can monitor the patient remotely also, and hence we can get excellent outcome can be measured. And we teach all these things in our real-based orthoplastic course. Those who are interested, orthopedic guys, they can join. And the other thing, what happened while America has been busy bombing Iran, spending $6 billion every day on the bombs. China has quietly built the first fully run agentic hospital, and they've treated already 7,000 patients. So this is where, if you go in the progressive path, you treat patients. If you go in regressive, you spend money, 2 billion per day, 7 billion per day, bombing some barren land like Iran. So here we see possibilities where others see a full stop at kind of a diehard approach really. This is what we created, what is called as a digital doctor using the AI. This is what I created after my course. And this is how it works actually. This is somebody else created.
Analyze
how
your
the
rank
agentic
performance,
AI works.
frequently asked questions by using SERP-API, analyze all competitors and creates detailed reports about the articles, analyze the article performance, and finally rewrite your article based on the overall performance and data. This automation saved not only a few hundred hours of work, it also helped me to improve consistently my organic traffic. It will analyze your data from Google Analytics, analyze your rank performance, quote frequently asked questions by using SERP-API, analyze all competitors and
So this is the future really, agentic. Already the agentic hospital is running. No CEO, nothing, run by the AI. So I welcome all to SSOC EL-based orthoplastic course starting 15th April 2026. If any question is there, I'm happy to take. I think I finished on time, 3 to 4, now 4 o'clock. I welcome any questions. I again thank Dr. Pranav and TPA for giving this opportunity, and I hope we can create a community where doctors are at the center. And I always believe that in healthcare, we need two components, patient and the doctor. The rest thing is, periphery, it's secondary details. We don't need them. Now, all of them have become important. Both the patient and the doctor has been sidelined in India. We have to regain this control. And that's why I think we are here. And that's why I hope Dr. Pranav Academy is here. So I welcome any questions. So thank you, sir.